Well, lots to talk about tonight, especially on what medical breakthroughs could possibly be achieved and the road ahead. We're joined tonight by Dr. Syra Madad. She's an infectious diseases specialist from New York and recently featured in the Netflix docuseries Pandemic. Dr. Madad, thank you so much for joining us on NDTV this evening. If I could ask you first, you yourself are a survivor of COVID-19. You got the infection, you've come out of it. Can you tell us about your own experience, what you went through and how you're feeling now?
First, thank you for having me on. You certainly, with COVID-19 and knowing that, you're positive, it's obviously a scary feeling because this is a novel virus and there's so much that we still don't know about this particular disease. Also considering how wide of a spectrum of illness, coronavirus actually has. And on top of that, the different manifestations. So a lot of people you're seeing obviously have mild cases, but even in those mild cases, they are experiencing a phenomena where they may lose a sense of taste and smell, a number of other obviously clinical signs and symptoms that may manifest. For me in particular, the first few days were rough, and then luckily it was a mild case, but I did lose my sense of taste and smell for about 3 weeks. I recently just got it back about a week or so ago. I live in a house with my own family. I have a 3-month-old baby, and I have 2 boys, and also, I have in-laws. And so it's obviously a scary feeling because you want to make sure you're protecting everybody. But luckily, everybody's doing well. And, it's one of those things. I think we were very lucky that no one had a severe case.
Well, Dr. Madad, we were just getting news just before we went on air tonight about Gilead announcing that it may have achieved a breakthrough in the Remdesivir trials for treating the coronavirus. Now, of course, it's still a trial, and I guess we'll have to wait and see, whether more trials are conducted and how those go. But are you cautiously optimistic about their announcement just under an hour ago?
Certainly, I am very cautiously optimistic, and I think that's a good way to put it because, I don't think Remdesivir is going to be the magic bullet that we're looking for. Certainly, it looks very promising. The golden standard, obviously, is a randomized controlled trial to actually see if this particular pharmaceutical, medication is successful and how effective it is. I think we also need to look and see how the study was conducted and then what the outcome is, both those that have mild illnesses and those that have severe or critical illnesses. At the same time, also looking to see when this drug is most effective. Is it early on in the course of the disease, or is it later on? So as you know, with Tamiflu, another antiviral medication, the earlier you take it, the better the outcome, if you will. So we really have to see, what this means. It looks very promising, but at the same time, we need to get some more information in terms of how it could be administered and how effective it could be.
You were mentioning to us some of the symptoms that you experienced when you got COVID-19, among them being the loss of taste and smell. Now, we saw that the CDC in the US yesterday, the day before yesterday, put out a list of new symptoms that people should watch out for. Among them was the loss of smell. There was also, headaches, chills. Now, I just had a question that what does that mean exactly? Because, if I get a headache tomorrow, someone just gets a headache, does that mean we should think we have the coronavirus and get tested? Or would it have to be, a headache plus, a symptom 1, 2, and 3? How does this work exactly?
So not necessarily, just because, so I think first, it's important to put into context where you are. So if you're in a geographical location where you have widespread community transmission of COVID-19, I think it's good to assume that if you become symptomatic, whether you have headache, fever, just a cough, I think it's just always good to assume that you may have coronavirus disease, and you should implement the measures that we're asking everybody to do, which means isolate yourself, don't come in contact with other individuals, obviously continue to take care of yourself. But I think depending on where you're located, if you're located in an area where there is no community transmission and you come down with a headache, then obviously it's a different story. But if you're in a particular geographical location, like for here in the state of New York, what we're telling everybody is we should already act as if we have COVID-19. So you need to continue to isolate yourself. And this is where it's also important to socially distance yourself and so on and so forth. But I think a really big, recommendation there is making sure that you follow up with your healthcare provider. So if you think that you're symptomatic, then certainly you want to follow up and see if you're a candidate to get tested, depending on obviously where you're located.
But the thing is that when you have a symptom like a headache listed in a list of symptoms, it's so vague and so general. Now, one gets headaches all the time. So is there a sort of a metric by which you'd measure when one has to get concerned? Would it have to be, for instance, a constant headache, a throbbing headache, accompanied by a cough and maybe some chills? Or if it's a headache that goes away with a paracetamol, does it mean we're okay?
So, if you have a mild version of coronavirus disease, so if you have a headache, cough, something that you can tolerate, so you may not need to get tested. You just want to make sure that you isolate yourself, obviously, for a certain period of time, so that way you don't start new chains of transmission. But the point where you want to obviously make sure you get healthcare services is if you start experiencing shortness of breath, because that's a telltale sign that that you're going to need potentially additional healthcare services. So just having mild signs and symptoms, just a cough or headache by itself, may just mean obviously you have a mild case and you may not need to see a healthcare professional. We want to make sure, similarly here in the United States, and I'm sure even in India, that we want to reserve hospitals and healthcare services for those that truly need it. So if everybody that has a headache goes to these hospitals and healthcare clinics, then you're going to obviously get overwhelmed. And so you want to make sure you're reserving it for those that critically need it. So those that maybe experience shortness of breath and other more severe signs and symptoms should obviously seek healthcare services. But at the same time, it's also important to make sure that you're in contact with your healthcare provider. So even though you have a cough and a headache and you have a mild version, it's always good just to consult your healthcare provider to see if there's additional steps that you should take, because it also depends on your own clinical condition. Maybe you have underlying health conditions that may warrant that you seek healthcare services sooner.
My final question, Dr. Madad, is about the lockdowns and when it's the right time to actually lift them. Now, we've heard Dr. Fauci say in the US that he's worried about another wave of infections in the fall and in the winter. Is that something that you think the whole world needs to be concerned about? And we also can't live in perpetual lockdowns. So what's the road ahead going to look like for the next few months?
Look, no one likes to be obviously in a lockdown, in a situation where we're, confined in our home, and it's having impact not only on the economy, but also our own social well-being. So no one wants to obviously put anyone in that position. At the same time, it's needed because we need to make sure that we're reducing mortality and morbidity. Right now, since the coronavirus disease started obviously in late December, early January, there hasn't been a whole lot done in terms of treatment options, right? So we have a number of things in clinical trials. We have obviously something like Remdesivir that looks promising, but nothing is a magic bullet. We have monoclonal antibodies that also look very promising. We don't have a vaccine yet. And so one of our most effective methods right now to reduce morbidity and mortality is social distancing. And so I think we need to have a very methodical approach if we want to start opening up various areas. And there needs to have a system and infrastructure in place, like having testing available, so that way if somebody thinks that they need to get tested, if they're symptomatic, that they're offered the test and they can then isolate themselves, and then we can contact trace. And so we need to have a good infrastructure in place in order for us to obviously start opening society up.
All right, I think that's the key. Thank you so much, Dr. Madad, and we're really happy that you recovered from this and you're well. Thanks so much for joining us on NDTV this evening.